Hi, I'm Dr. Kuharaj Balasubramaniam. I am a consultant obstetrician and gynecologist in Assunta Hospital, Petalinjaya. Today we're going to actually talk about uterine fibroids. Now, uterine fibroids are common benign growths of the uterus. If you look in the internet, it says smooth muscle tumors. Everybody gets scared when they hear the word tumor, but tumor can be benign or malignant, which is cancerous. So, these uterine fibroids are usually benign. Very, very rarely are they cancerous. Uterine fibroids are actually quite common. It is estimated 1 in 3 ladies has a uterine fibroid. Now, that doesn't mean you have to freak out, as usually they're so small they can't even be seen on ultrasound. If it's about 1 centimeter and above, usually it's easily seen on ultrasound scan. But some can grow quite large, and the symptoms that the lady might experience is very dependent on where the fibroid is. I always say fibroid is like housing, location, location, location. Where it is on the uterus causes a different symptom. So if you have a uterine fibroid within the lining of the uterus, like here, or pressing onto the lining of the uterus, inside lining of the uterus, or the endometrial cavity, you can have heavy bleeding, which is called menorrhagia. If it's within the muscle, you can sometimes have some discomfort and pain, sometimes during your periods. Most of the times you don't actually have symptoms. But if they are sticking out here like this and pressing onto other organs, like what we call a subserosal fibroid, sometimes it can even hang out like a fruit, right? With just a stalk there on the side. They can press onto the other organs. If it's in the front, it can press onto the bladder, which means that the lady will complain that I can't hold my urine for very long. I feel like I need to pee all the time, even when it's a little bit full. If it's at the back, that's where the bowel is, and they feel like they have difficulty in passing motion, and they complain of sometimes constipation. And sometimes they have no symptoms at all, and they say that they think they're putting on weight with a large big fibroid growing inside. So the symptoms a lady experiences are totally dependent on where the fibroid is within the uterus. This is something most people need to understand.